This idea of turning the contact center to a experience hub really aligns in what we need to drive value-based care. It starts by aligning the outcome, the patient engagement, improving the outcomes, optimizing the care coordination, really thinking about it not just as a remarketing or branding effort, but a fundamental shift in the mindset of the organization about being proactive in every single step and part of the patient journey. When we think patient experience, many images that comes to mind has strictly to do with the care and the engagement between the clinician and the patient. But those kind of micro moments are, did I call and was I able to get an appointment for the services that I needed? Was it easy to navigate on site to find where the department is to see services? What does that follow up process look like? Versus just kind of printing out a piece of paper and saying you make the call to your physician and make the appointment. But there are always going to be times where someone needs to talk to a human. For leaders, when they're thinking about how and where to implement AI, they should think of where is the tool going to amplify the human experience and not take away from it. You really want the AI to be in the background, something that's enabling the experience and you don't even know it's happening.
Ebony Langston is a vice president at TTEC, an award winning healthcare strategist, and a national voice on how tech, trust, and experience drive equity. She's helped drive over 20 million in payer growth, leads AI transformation at scale, and still centers equity in every interaction. If you're building care models that scale, serve, and sustain, this conversation is for you.
Tell us about micro moments.
Micro moments are basically any time you're engaging with the patient. So I think when we think patient experience, many times images that comes to mind has strictly to do with the care and the engagement between the clinician and the patient. But those kind of micro moments are, again, did I call and was I able to get an appointment for the services that I needed? When I got site, was it easy to navigate on site to find where the department is to see services? Hospitals are notoriously confusing to navigate around. And often you have to go to different places for, x-rays in one part and actual doctor visit in another part. And, how are you helping people navigate through at each part of the journey after they receive services? What does that follow up process look like? Proactive follow up has been shown to be really impactful on making sure people are actually following their care plans versus just kind of printing out a piece of paper and saying you make the call to your physician and make the appointment. We put a lot of onus on the patient, and obviously there is accountability in our own health outcomes, but the way that the system is so disjointed, there's really a lot of opportunity for us to help be an actual care navigator for them.
From the patient journey, from start to follow up, is there any particular moment in time that you think is most critical for keeping patients engaged?
Think that there's a specific moment in time because I really like to think of engagement as longitudinal. Most hospitals are using surveys, HCAHPS, satisfaction measures to think about experience, but it's really just measuring what your last interaction with the hospital system was. Experience is measuring more long term experience and engagement with the system. And that I think you measure more by patient retention. Do they come back to your system after they've received that initial service? Are they trying to keep all of their services within your same hospital system? Things like, are they actually following up on their care? Do they trust that you have their best interests in mind and thus are a proactive partner in their care journey? So I think it's the whole experience, not just in one individual moment that makes a difference and the consistency between those interactions and those experiences.
I think one point we're very aligned. We're very aligned at many points, but I think one that really stands out to that point is is it, feel free to refine this, but when this system fails, it's not always just a lack of access, but the invisible breakdowns between those critical access points.
It is. One of the things we do a lot of work in is in AI language translation. And so just think about this. You may have all of the schedule availability in the world, but if there's a communication breakdown for a patient who English may not be their first language, and as they're trying to make that appointment, aren't quite clear with the person on what type of services that they need, end up getting scheduled for something completely different. That's another kind of opportunity to miss building trust versus using something that enables communication in their first language where they feel more comfortable in communicating, can help them feel more confident that the person on the other end actually does understand what it is that they're trying to communicate and what it is that they need.
I want to pivot to that since we brought up the AI, as we're increasingly being expected to incorporate tech in this industry as long as because all of the other industries are, whether it's CRM systems or automated outreach or those AI tools. Are there specific questions that healthcare leaders need to be asking before layering in this sort of advanced technology that interacts with vulnerable populations?
Yes, there was an interesting conversation with a hospital system who asked a teammate of mine how they can kind of get rid of all of their contact center agents. And I'll start with that is the exact wrong question to ask. Because in the healthcare system, there are always going to be times where someone needs to talk to a human person. And so I think for leaders, when they're thinking about how and where to implement AI, they should think about it in the context of where is the tool going to amplify the human experience and not take away from it. You really want the AI to be in the background in most cases, not a tech inhibitor, but something that's enabling the experience and you don't even know it's happening. So look at those opportunities for amplifying the human experience. Again, things like AI language translation, the contact center knowledge bases to provide the right answers at the right time. Accuracy builds confidence and trust when people think they're getting the right information from you. And so, yeah, those are the areas that I think where it makes a big difference. How do you humanize and amplify the human experience?
Definitely. So AI can't replicate that trust building that's so critical to keeping patients retained. Do you have any advice for those organizations who want to lead with transparency, especially when funding or infrastructure is still catching up?
Yeah, I think again, being very clear on what are the outcomes you're trying to drive and how you're using the technology to drive those outcomes and being transparent around that. Using things like front facing AI bots is great as long as you're transparent about that is who the consumer, who the patient is actually engaging with. You never want to be in a situation where you're trying to trick a patient into thinking they're engaging with a human. You always want to be transparent in how and where that technology is being used. Also, transparency in the models that are being used to train the technology. Obviously, there's a lot of talk about data privacy and potential biases in models, which just comes from systemic structures that we have within our healthcare system. And so being transparent about what was the data that was used to actually train the model to drive these outcomes and monitoring the accuracy of those outcomes over time.
Why is it important to be transparent about the inputs?
Yeah, the outcomes are only as good as the incomes. And I'm sure you've heard bad data in, bad data out. Understanding the source of the data, what data is being used. Is it a diverse set of data? And again, depending on the outcomes you're trying to drive, it's important to understand is that um, data showcasing the diversity in the population that you need to use it in the outcome in the situation that you're trying to use it in.
Definitely. When you talk to new organizations or a new partner, do you see any common levers that are often underutilized for keeping people engaged in programs long enough to drive that ROI?
I think it's really, again, more about the shift in being proactive rather than reactive. This idea of turning the contact center to a experience hub, I think, really aligns in uh, what we need to drive value-based care. It starts by aligning the outcome, the patient engagement, improving the outcomes, and optimizing the care coordination so that you can build enduring trust between patients and providers. Really thinking about it not just as a remarketing or branding effort, but a fundamental shift in the mindset of the organization about being proactive in every single step and part of the patient journey. From a community organization standpoint, I start to think more about those social determinants of health and where that community organization can partner with the hospital system in order to improve some of those situations that may be impacting health. Housing is a popular one, and there's a few health systems out there who are partnering with community housing partners to help provide options for their patients. And once you solve the housing problem, you see the health outcomes for that population start to improve.
If a CEO or a health plan leader asked you, what would it take to build a care model that truly serves people that we've historically failed? What would you tell them?
I'd say one, invest in data and analytics. Being able to really understand your patient population, how they are impacted by different care outcomes historically, how their cultural background may impact how they engage with the system. I often think about my aunt who passed away 20 years ago, but before she passed away, I got a chance to sit down and have a conversation with her about her condition. She had cancer, and in our family, we didn't talk about what was going on with the grown folk, right? And that's kind of in many Black households, that's a common thing. And in talking with her on kind of her journey and how she got to where she was and how her condition had deteriorated, I found out that really she was at this point because she had a real lack of trust in the healthcare system. She had delayed and denied going to seek treatment because she did not trust that this system really had her best interests in mind. So I think for a healthcare system to really engage and start to close health equity gaps is having a good understanding of also not only what the traditional clinical outcomes are, but what are the cultural contexts that people may be engaging in the healthcare system with?
Some of my own experiences being a social worker for vulnerable populations and his experience and going through medical treatment for years. A lot of horror stories, and I finally feel like I'm getting the right care here in hospice. And this was a Black man, and it wasn't until he was in hospice that he felt like he was getting good care. And that's just one of the stories that will stick with me probably forever. So I'm glad that you brought that up because I think it's something that we don't talk about enough.
It is, and it definitely impacts how people seek out care. And organizations who understand that and implement strategies that include that context, I think will see their outcomes improve.
Another thing I wanted to talk about is in your thought leadership, you talk about how wellness isn't a luxury, it's infrastructure. And so, what do you think that it takes? What does it look like to build a philosophy into the way that we design care for frontline workers and patients alike?
Yeah, I think again, thinking about technology in a way that it humanizes the experience, amplifies the ability, but also takes the burden off of people. So, thinking about it from the staff experience perspective, what are those routine, mundane tasks that are taking up valuable human time that we could just automate? free up their time, and allow them to focus in on more complex patient empathy and health outcome issues. The CEO of Commonwealth gave a talk to his employees and made a statement that every person in the company is a healer. No matter what your position is, everyone is a healer. And if you give them the tools to help take away those burdens, everyone can be a healer. Everyone can make some, deeper connections with patients and really help encourage them along their journey. You covered a lot. I think, again, just understanding that a focus on experience is also a revenue driving move. Systems that excel in patient experience generally see 50% more revenue and higher profit margins than those with average ratings. So it's not just like a feel good movement, and obviously improving the health outcomes is ultimately the goal. But there's also significant revenue drivers and incentives to a focus on patient experience as well.
That's right. I saw your post today
Yeah.
about the case.
Yes, every time I do a little bit more digging on how much an impact experience make, and what seems like minor things turn into big revenue dollars. $200 for every missed appointment turns into billions of dollars of costs that could be redirected to research, to all kind of other things. So there is lots of opportunity in the experience that just has so many implications in other areas of the healthcare system.
How do organizations design contact centers around those human needs without sacrificing performance?
I think you get the people involved, get smart people from every part of the organization who can contribute to how the patients engage in their area of the business, and what are the things to think about upstream and downstream. Map out what your experience is today and what the ideal experience is in the future. And again, find those opportunities within the experience where you can infuse technology to amplify the human connection.
Empathy is a catalyst for ROI and scale that I think is under leveraged. I think that's something we both can agree on.
Absolutely, for sure.
You've helped transform contact centers into trust building machines. For social care programs that are trying to scale, what lessons can we take from patient engagement strategy that actually drives outcomes?
I think in the context of the contact center, thinking about it strategically and making a strategic shift from it being just a contact center to an actual experience hub is directly aligning with where healthcare is going in value-based care. So by significantly enhancing patient engagement, improving health outcomes, optimizing care patient, really focusing on enduring trust and building trust, fostering trust between patients and providers, you're creating an ecosystem where patients come back to you over and over again. That turns into higher revenue, better profit margin, better satisfaction, and ultimately better health outcomes.